Our call today is an hour and a half, and the recording will be shared out following the call. We have 3 primary questions to help guide our conversations today, which I'll read out now. What do weather, service, and COVID-related conditions look like on the ground right now? And what priorities or concerns do you anticipate on behalf of people who use drugs, SSPs, other programs, and so on? 2, how have programs been responding and what strategies or ideas are currently being explored for navigating this intersection of winter weather, COVID, and drug user health? And 3, how can state health departments, national partners, and others best support people who use drugs and the programs that serve them during this time and in the coming months? I will also enter these questions into the chat box. You are welcome to provide comments via chat box or by unmuting your line. We have a small enough group today, I think, that we can have everyone manage their own speaking. If you're not speaking, please keep your line muted, but we'll adjust if we need to. Unfortunately, today we don't have time for full introductions from everyone on the line, but please keep in mind that call participants will include community-based programs, local health department-based programs, state health department staff, program funders, and other partners. So share the messages that you want all those folks to receive. Finally, my name is Lily Armstrong, and I'm a senior manager with the NASTAD Drug User Health Program. Thank you so much to everyone joining us today. When contributing comments, please be sure to share your name and where your program is located. A lot of you are doing that already in the chat box, but since this is just such a geographically dependent call, we'll try and get a sense of where everyone's calling in from. And if they're available now, I will let my co-facilitators, Laura and Drew, introduce themselves, and then I'll share those questions in the chat box and we'll get started. So glad to have an opportunity to learn from you all today. Laura?
Yeah, thanks, Lily. Thanks so much. And thanks everyone for coming out today. This is, it's hard to believe that it's been 6 to 8 months since we had the call right after COVID really hit hard across the country. And we have been trying to find really meaningful ways to support programs on the ground and really find ways for health departments and programs on the ground. Oh, can you not hear me?
I can hear you.
Yeah,
I can
hear you. Oh, okay, sorry, thank you. Anyway, yeah, it's we've really been trying strategically over the last many months to figure out the best ways to support programs, and I'm excited here today to be talking about how to make yet another transition in our seasons, and figure out what people are thinking, hearing, feeling about how to transition our programs back indoors or to prepare for a brand new season of COVID. So as sad as that makes me, I am also really grateful, like Lily said, to have everyone on the line today. So excited to have this conversation. So thanks, Lily, and I'll pass it over to Drew.
Great, got it, thank you.
Thank you pretty much said everything I wanted to say. Just wanted to add that this really is about us getting a better idea of what you all have faced so far during COVID, and what challenges you anticipate facing during the winter, and any plans you might already have in the pipeline to address the myriad issues that we're going to face with the emergence of a arguably third or just really long first wave of COVID transmission, and winter weather around operation of SSPs. So I will be on the call along with Lily and Laura, taking notes, and we encourage you to reach out to us after the call as well, to follow up and to make sure that this resource that we're creating is as helpful as possible.
Thank you, Drew. Kirsten's on the line. Kirsten, would you like to say hello?
Yeah, thanks, Lily. Hi, everyone. This is Kirsten Forseth. I am also on the drug user health team at NASTAD, and glad to see so many of you here on the call and looking forward to the conversation. Thanks.
Great, thank you. Well, that's, I think, all of our business end for this call. If anyone would like to help get us started, we can also repeat any of those questions if helpful. So any feedback or updates about what folks are seeing and how they're starting to plan for or anticipate increasingly cold weather.
This is David Washington from Maryland. I'll assume you can see me because you're smiling. And the one thing that we've been doing is talking to participants now about bad weather. We're hearing that there's going to be a first freeze tonight. So we're just telling people, if possible, would they like to take double the amount that they normally get?
Are you getting any additional, or have you expanded any supplies that you're distributing during COVID, or anticipating how it might change during the winter?
Luckily, we pretty much are pretty sure that our funding is going to be coming through. So we were able to order double what we had ordered last year. And when COVID hit, we immediately started saying to people, we know it's hard. They don't want you to be outside. Would it help if you had like 3 weeks worth of supplies instead of a week? And most people were like, yes, definitely. And then being able to get people masks. We are a little worried that we are a state facility, so in times of bad weather, maybe unlike some community-based programs, we will have to lock our doors just as a state agency. So again, trying to just prepare if something like that were to happen.
How about mobile outreach? Are you able to do?
Oh yeah.
Yeah.
Oh, yeah. I mean, we're really fortunate to have an awesome director. Probably in May, 1st of June, we were able to start going out, not as much as we are now. We're out like 4 hours on Monday, 2 hours on Tuesday, and then we're doing home, for lack of a better, home visit for those that have had non-fatal overdoses. So we're taking Narcan and harm reduction items to them, knocking on the door. Well, we're doing a phone call first, and if we're unable to reach them by phone, then we're going to their homes and knocking on the door. And that's worked out pretty well. We've been able to get some people into treatment, as well as just to talk to their family members about harm reduction, what's available in the community. And that's new for us. We hadn't been doing the door-to-door type services.
And so that's a harm reduction led, or at least inclusive, team that's going out for those post-overdose responses.
It's part of our overdose response team. And we just said, you know, harm reduction has always been a part of it, but now we actually have a harm reduction staff that goes with the peer recovery specialist.
That's excellent. Very cool. So Maryland has talking to participants, planning ahead for bad weather, and being able to alert folks when there might be a turn coming, noting that funding needs to accommodate increased levels of supply distribution, relying on participant feedback about needs and numbers that folks are needing, and definitely wanted to note the inclusion of harm reduction services in your post-overdose response. That's great. Any other update? Jurisdictional updates?
Everything smells so tasty.
Is there anyone on the call? Who's already wintry weather? I'm sorry. I'm getting.
Check. Hello, can people hear me?
We can. It might help if you make sure you're muted. I think that might be.
Okay, cool. Hopefully it doesn't echo anymore. Hi everyone. My name is Aaliyah. I'm coming from Charm City Care Connection, a harm reduction drop-in center um, in East Baltimore. And we have really been struggling to figure out, basically our space was used largely for, we have like SSP and case management and stuff. We also offered hot lunch and people would come in to rest in our space and get away from the elements, take naps, things like that. And I think we're really struggling with that piece, how to provide that to a lot of our folks this winter, since people are not able to come inside. And also, it's just been really challenging staying connected with people who we used to see every day, who would come in for food or, you know, rest and things like that. So we're trying to adjust, and yeah, basically are planning ways that we can still provide some of those things, but it has been a real challenge. Yeah.
Thank you for sharing that, Aaliyah. Definitely hearing from a lot of folks the challenge of staying connected and not being able to do outreach in the usual places because kind of all your folks have dispersed. Has anybody found good ways or unusual ways to improve communication with participants during the pandemic? I've been hearing a lot about trying to co-locate with other kind of emergency services and try and obviously meet people where they're at to reduce the number of trips and connections that folks have to make.
Yeah, I just want to echo what Lily had mentioned. You know, in Aaliyah, it sounds similar to what we're hearing from a lot of places across the country. Really, you know, in light of COVID, there's been a lot increased destabilization, destabilization in terms of our folks who are unhoused at this point, and in some cases, very sort of aggressive measures to kind of tamp down on public camping, public convening, public gathering, which is problematic in a lot of ways. And I guess I'm just curious if any programs on the line have been thinking about how, thinking about or having strategies about how they have been improving the way that they kind of track where their folks are so that they can be reached to get them into services or make sure that they're getting extra access to care or different types of services or resources, even thinking tangibly about clothing or any types of supplies like that. Any strategies that folks have to share would be welcome.
I could speak on my experience. I'm here in the Bay Area. We're still having kind of unseasonal, nice-ish weather. But I mean, as far as like, COVID and kind of, having some disconnect with participants that I deal with, the program I work for is just really, gone full force with a robust outreach program and trying to stay connected that way during the pandemic. But with that being said, uh the winter is coming in, and though we don't have as bad winters as other places, it does get cold and wet here, and will still pose a problem as far as you know reaching people with the pandemic and the weather getting bad. The people that I work with, we are actively trying to think of how we're going to approach reaching our folks in the winter. But it's still in development.
Yeah, that's awesome, Ryan. Thanks for that. I mean, a lot of people are kind of putting in the chat some increased, trying to be creative around coat drives and other types of, you know, more mutual aid ways to find, especially cold weather gear, you know, and clothing, things like that. Anyone else been engaging with any of that?
Hey, this is Deborah from IHRC. I think for us, we have in Des Moines, Iowa, we have about 1,000, probably more now, but around 1,000 folks that are houseless and in camps and just kind of scattered throughout the city. And I find that if our volunteers and our outreach programs, if we're just being consistent and being in the places that we're at a certain time, on a certain day, that's actually really helped us a lot. So instead of like us just kind of moving around and going where we, you know, we just used to kind of pop up at places, and now having like a more consistent schedule has actually helped us keep in contact with quite a few folks. So, I mean, that's just another thing that we kind of implemented since indoor stuff kind of got ruined.
That's great, Deb. And then, you know, folks have a little bit more of a time window and they're not, hopefully less hanging around for both the outreach folks and the participants to try and make some of those connections.
One thing I've been personally thinking about a lot is, you know, during this pandemic, I've definitely seen the rise of, you know, community mutual aid groups pop up everywhere. And I think like something that we should all, you know, think about, or that, you know, might be good to give some thought in, is just like unconventional partnerships, you know, like, you know, I think traditionally as harm reductionists, we kind of just like partner with certain kinds of CBOs, and like maybe you know, reaching out to local like mutual aid groups, you know, might be beneficial, you know, to everyone. And you know, the folks that we see, you know, I don't know exactly what it looks like. I guess it depends on what kind of community you know, groups are popping up like in everyone's city. But you know, it might be something to think about as far as how we all approach you know, taking care of our folks during this time, making sure you know, all their needs are met.
Ryan, that's a really great point. And this is Jenna from New Jersey. And so our focus is places where there, at the New Jersey Harm Reduction Coalition, focus where there aren't existing harm reduction programs. So I see Martha is here. Like, for example, Martha runs an incredible program in Camden County. So we don't focus in Camden County, we focus in the places where there are no programs. And the mutual aid partnerships have been a huge ability to do that. So the places that are doing food delivery, like we can partner with them to add harm reduction supplies to their offerings, and then they can deliver like naloxone and things like that with their other supplies, and people can request it. And then with some of the like Black Lives Matter food pop-ups, integrating harm reduction supplies into the offerings of those food pop-ups, and just really like taking advantage of what really seems like a resurgence in mutual aid organizing to include harm reduction as part of that.
Those are both great comments. I'm thinking about conversations we've had with a couple jurisdictions about kind of a community mapping process, because the landscape of services has changed so much since what maybe folks were used to being able to do during winter. So trying to come up with, are libraries open, and so if so, under what conditions, where are public bathrooms available, what does the kind of public warming space plan look like for your area to navigate social distancing restrictions and all of the rest. So I imagine that like through that community mapping process, Ryan and Jenna, what you all were talking about, you're able to see like what maybe new services or new functions have kind of come up recently, but also so promoting that for your participants, but also getting a better sense of, for your organization, what points of contact might be fruitful.
Can you all hear me?
Oh, sorry.
I'm sorry. You can go ahead.
I just wanted to add that I mean, personally, outside of any organization I work for, I've personally been in touch with a few mutual aid groups, and it's a good opportunity for us to more normalize syringe access and naloxone distribution by people in the expertise, kind of helping these mutual aid groups incorporate harm reduction and naloxone distribution like into like the mutual aid they're already doing, whether if it's food or household supplies, like that kind of just adds another thing to their wheel of things they're able to supply, and just more normalizing syringe access across like all CBOs, like all organizations that work with the community, like should have naloxone and like clean supplies available to folks. So I mean, there's that too.
Okay, sorry, my mic is like not the best in the world, so I gotta check. Thank you all for talking about this, specifically like with weather coming up, and what I like hearing what all plans you all have to approach that issue. And I'm here in Virginia, actually, at the health department. We have a fixed site, so people come to us at our health department to do comprehensive harm reduction here. And that, I think that's been working just for our location, because we live in a very mountainous rural area where it's very spread out. We don't currently have a mobile unit. Hopefully in the future that's something that we could get. But for now, we're doing what we can just from our fixed site. We have increased the amount of supplies that we give out to each person since the pandemic started, and that has been that's been really helpful in just like cutting down on the contacts and the possible spread in our department. Also, I think most of our participants really do like that, just because they don't have to worry about trying to get to us as often. So unfortunately for us, as far as funding goes, we have to have a cap on the amount that we can give out, which is definitely not best practice, but our program has grown quite significantly and our funding hasn't grown with that. So that's where we're at with it. But one thing I was going to just mention to everybody, I just started overseeing this program a couple months ago. So I'm still learning it and working at it. But one thing that's been helpful for my folks is I've gotten them resource packets. So like each time a person signs up with us, or they come in and they're needing stuff, I have these packets ready to go with a list of all resources in our area. I've got our crisis centers, I've got our shelters, our like all sorts of stuff as far as social service type information and all that, all together in one packet, and I'm handing that out to everybody, just so that they can at least have these numbers and these contacts and know where to go. We have one of our programs that's pretty local, Hope Ministries, I think is what it's called. They came up with this thing called a street sheet. and it's just like a one pager, but it's full of resource information. It's got like the homelessness response team numbers. It's got employment resources, all sorts of stuff on it. So that might be, I'm sure a lot of you all have that sort of thing, but I think just making sure that everybody has those ready to go, especially when weather gets bad, is probably a good thing. Thank you all.
Hi, my name is Robert Hoffman. I'm from the Bay Area also. I put it in the chat, but a couple different things that we've been doing is, number one, we're a pretty large syringe and health access services program. And so we have our staff working in pods, isolating them from each other. And that way, if anybody gets sick, we can still, we could just quarantine a group instead of shut down. And another thing we've been doing is, Ryan spoke about our robust outreach. So we've been collecting a lot more data as people have been getting displaced around our city, and we have about like probably 7,000 to 10,000 people experiencing homelessness in our city. And so we've been collecting a lot of data, and someone on our team was skilled enough to write some R code, and that data gets transferred into heat maps that our outreach team can use to kind of both identify like where there are camps with Latinx folks who were trying to build relationships. And then just like basically where all these camps are moving and when's the last time we served them. So I shared a link to that in the chat. But those two things have been really helping us kind of maintain these services, since we haven't been able to do a lot of our drop-in services where we saw the most participants. And yeah, and so then just increasing the access to like, PPE for people experiencing homelessness, hand sanitizer, and other hygiene supplies is something we've been doing. Thank you.
Thanks, Rob. I've also been trying to follow along with some of the comments, including about your data system in the chat box, and note if there's obviously a conversation about the other types of supplies that folks are distributing and trying to find sources for hand warmers and the like. Also some questions about utilizing drop boxes as a way to provide perhaps a more steady stream, but also reducing the need for in-person contact, if anyone wants to speak on their experience with that.
So hi, my name is Sarah. We are in Pueblo, Colorado, and we're starting to kind of try some new things. Couple weeks ago, we added evening hours and rolled out a Google form for folks to order ahead of time. And it's been really awesome. We actually had about 20 people show up on our third night of that, which is pretty high for a first night of new programming. We're currently operating outside. We're seeing double the amount of folks we were back in February. And we're really lucky that we actually happen to have a drive-through window on our building. And so we're trying to figure out how to best utilize the drive-through window and the Google form. So just saw that question in the chat box. What we're doing with the Google form, we're providing that, but also offering a call-in option. Most of our folks do have a phone. Most of those phones are smartphones. So we created a QR code and we're passing that out on a weekly newsletter. We also have a link to the Google form on our Facebook page, and people honestly love it. Like, especially our younger participants, they're screaming excited about it because they know that, it's like, oh my God, you can order food online and now you can order syringes. So that's been that's been helpful for us. But yeah, we're nervous because we're not allowed to let folks inside right now. So just trying to keep them out of the weather. We actually had 8 inches of snow on Tuesday, and we ran programming. We aren't going anywhere.
Cool. Sarah, that's awesome. I'm always glad to hear about Pueblo and, really trying to anticipate needs. I guess, I'm curious if anyone on the line, we have a good mix here between sort of health departments and people, folks actually operating programs. I guess I'm curious, have any of the health department folks been able to sort of advocate for increased resources for cold weather gear, for outdoor heaters, hand and pill warmers, things like that, for SSPs in particular? Thinking, both about, your health department, regular HIV and hepatitis money, but also like the COVID money, or if any of the community-based groups have been able to broker any of those relationships to get increased resources to where we know they're needed.
Yes, hello. My name is Kevin Gavitt. I work for the State Department Department of Public Health in Massachusetts, and we have actually been approved to use the COVID funds for outdoor heaters for our programs. And so we've actually found that to be one of the main resources that people are needing, because obviously they're setting up tents and everything outside. But today we already have about 3 inches of snow on the ground, so they really need to get these heaters up and running just so they can still do the job effectively and that the clients are still safe.
Awesome. Thanks, Kevin. I'm sorry. It feels so early for snow. That's why we're having the call. Any others?
Well, Laura, to your question in the chat about ventilation systems, that's not something that I've heard any helpful information about yet, and would be really interested if people on this call plan on using your indoor spaces, if there's adaptations that you're making, or resources that are being made available to really think about your kind of ventilation systems in indoor space.
Yeah, and I'll just add to that. This is Kirsten. I think I was the one who put that question in the chat. I'm really interested to hear from folks too. I've seen a little bit around, different types of air filters that could be used, using fans to sort of, clear aerosols from a room, sort of during and in between seeing participants. Or keeping windows open, at least cracked, to have some ventilation. But yeah, nothing that I've heard kind of being practically done out in the real world.
Hi, this is Jessie with Baltimore City Health Department, and also SPARC, which is a harm reduction center for women with Johns Hopkins. So Baltimore City Health Department has continued to see patients at the infectious disease clinic, that is the STI clinic, HIV clinic, and Hep C clinics, but it's on a very small, modified sort of situation where it's one patient at a time. And I'm not sure what the efficacy of the air filtration systems and things like that are. So I would be hesitant to purchase expensive things that are as seen on TV right now, just because I'm not sure what the efficacy of those are. I know that open windows definitely are a plus, but as winter happens, honestly, our clinics don't even have windows. So we've been doing one patient at a time, along with masks and shields, and then like plexiglass at the front desk. And we're thinking about modeling a similar situation for the Spark, which is the harm reduction center. These are two things that are kind of unrelated, but I work with both of them, where it would be one patient at a time, and sort of, yeah, but basically a very low-key modified schedule.
Yeah, that's.
Hello, I'm Rose.
Go ahead.
You saying? I'm Rose Johnson from Charm City. Basically, we've been operating on really not having no clients in the office at all. We've been working outside. We just recently moved back into the office, letting some of our community advisory workers come into the office. But we were basically moved to having our clients be back out. Well, they haven't been inside at all, but be outside. But we're gonna have a resting area where we're gonna have heaters, and we're gonna have like a food area. We're gonna bring out clothes like a couple of days a week that's already like pre-packaged and all that, size is ready, things like that. And for as outreach, I've been running outreach for the last like 8 months as far as COVID. Well, I've been running it since last year, but the last 8 months as far as COVID, I've been basically giving out bagged everything. I pre-bag everything. I give them pre-bag lunches. Everything is bagged. I wear a shield every day. I wear everything I need to have. I have cones keeping the people like 6 feet away from me. I practice that a lot. Like I don't let nobody get within 6 feet of me. So that's been working good. A lot of my clients that I see on the street, I try to get them to come to the office, which they've been doing a lot lately. Our I can say our business as far as outreach really went like quadruple since COVID. Like we had 3 times the amount of clients that we've been seeing. So I think things is working good for us. We just hope our next phase work out. So that's basically what Charm City doing.
This is Drew Gibson from Age United again. I just wanted to check in with folks. I've heard this a couple times now in the chat and via the audio feed about much higher levels of participation, and was wondering how much of that is folks seeking SSP specific services, and how much of that is just related to stressors related to COVID in general. So maybe people who aren't people who use drugs, but who know you as a community resource.
Hi, this is Lauren from Charlotte, North Carolina. I hope my microphone is working. I've been having some trouble on this call. Oh, good, Lily, thumbs up, thank you. To answer that question, what I can definitely say is we've seen a huge uptick in program enrollment, and it's not just because we're another local resource. These are people who use drugs, who need access, who can't get into certain crisis centers or shelters or detox or whatever they're looking for. So, I mean, we've really increased the numbers, and it's a good problem to have if we can continue to we want to sustain it. The other things that I was hearing just throughout this call and what we've been doing, and I echo a lot of what others have shared, is, increasing our supplies as far as what we're distributing. So we're handing out larger quantities, especially if somebody has an exposure, they're sick. Also, because of withdrawal and other symptoms, things are, people are going for, we're trying to find alternatives and getting people help so that they can move through the sickness. Wound care is definitely on high demand, so we're finding alternatives to get to people, and we're taking more aggressive approaches there. We've ramped up a lot of peer exchange, and I haven't heard that yet on this call. We've really relied on a lot of our program members and other volunteers to be disseminating supplies and education throughout the community. We portion out pots of, just funding that we receive to make sure that participants and volunteers are taken care of. So we make sure that any help at any time that they're, offering, it's just all compensated, and we're helping to meet basic needs, especially with the pandemic and with the upcoming seasonal challenges. We rely a lot on local partners. I know I've heard a couple of people talking about collaborating with other resources. We are a community-based syringe service program, and we are in a pretty resource-rich city, but it's very siloed. That said, we have partnerships with the health department, with HIV organizations, other shelters, and other organizations that help us share this load. So as far as, if you have the ability to do it, definitely see who else is in your community providing these things, food, meals, clothing. I heard a lot of that, but that's what we do. I mean, it helps so much. It improves and expands our reach, and, just kind of shares it throughout the community so people have a lot of access. Virtual supports have been really hard for us here. And I think that could be a huge aid for funders. If we were able, I know that people lose stuff very easily and it can be very challenging, but I wish we had more options to give people. A lot of people are able to very safely keep an iPhone or a smartphone or whatever it is on them. And that way they can always call and have some sort of connection. And even if they lose the phone, at least they had it for a moment where, there could be a life-saving opportunity. So, I think the more stuff we can get out to support them virtually, the better. And that's really where I digress. I've just heard a lot of great things. So thanks for all the ideas, and I hope this helped.
Lauren, I've got a question, and then I'm going to throw it to you, Diane. I've got a question from the chat box, either for you or somebody else. For those who are providing needs-based exchange, but who also are capping supplies because of shipment delays and wanting to make sure that there's enough to go around and all of the rest, what is the cap that you're using? And then if you adjust that cap for any reason, like Lauren, you were talking about peer exchange, do you have a system for working through that? So I will open that question up to the call, but also Diane, if you wanted to speak now, please go ahead.
Hi, this is Diane. I'm from Greenville, North Carolina, and I have a community-based organization. And so to answer your question, Drew, with our organization, normally we have about 80 to 90 participants on a Saturday, and we've seen that to increase to close to 200. Of those 200, about half of those are people who do use drugs, but are not injection drug users, who come for other supplies that we're able to offer, and the other half are mostly people who are homeless, found themselves homeless. Some bring their whole families, a mother, father, and maybe 4 kids just to get a sandwich and food cards and bus passes and those kinds of things. So one of the things that we did was we did move we used to be all in one room, and so we moved the table that does have injection drug supplies into another room just for confidentiality for those people that are injecting drugs, in case that is an issue, and also for the people that come with children that just want sandwiches. We started to buy color books and things to kind of keep them occupied in the front and away from that area. So far, we've been able to sustain that increase with a small grant that we have and then the other funding that I have. But if it continues to grow, we're going to have to reach out to the community. Somebody else suggested that. So thank you.
Hello, this is Denise Lopez from HEPAC in Oakland, California. For us, we have not been able to allow people in the building, but we definitely have been setting up outside for our drop-in center. And we've seen an increase in the whole community come in just mainly to get food and hand sanitizers and masks. One thing at the exchange that has really increased is our mat services. especially due to telehealth. Now that telehealth is available, folks can use our tablets and use our phone, and that's been something that's been really successful and really great for folks. In the beginning of the pandemic, we were doing food truck style, but now we are back outside, and we started in August to do HIV and Hep C testing, and we're doing that in a separate tent with the sides up, one person at a time with a splash spit glass or that plexiglass, whatever it's called, an N95 mask, and a face shield. And of course, always changing the gloves. And then whoever's testing, like when I test, I prefer to put the gowns on and, you know, have the full PPE gear, but that's optional for the person. Some people say it's too hot. So that's been increasing testing. I think folks really just like the incentives, but also a lot of folks are concerned about their health, and we're linking them into care. So that's been really well. And we've also started, I think 2 or 3 weeks ago, we started acupuncture again. So our acupuncturist, herbalist, is actually doing ear and, pretty much ear acupuncture again. And the folks are loving that. They're really loving the human touch and the connection. People really miss that. It's been quite hard for us, and of course, for our participants, just, you know, having a social distance. But she's also doing the ear acupuncture with full gear on and be as safe as possible. And it's been working out really
well. This is Ro Johnson from Charm City. But as far as caps, we had a couple weeks in between where we had got low, and I took our limit down to 100 syringes for people that was coming into the center, or was coming to the center to pick them up. And Outreach always get 30 syringes, and they can always come to the center and get more. What I noticed with our clients is the lack of like having coming in for services. So while I'm out, I try to, like, you know, talk to them, spend as much time as I can with them, like like if I see somebody the day before and they ask for something, I'll bring it back to them the next day. Like, I just try to keep it real personal with them. Like, a lot of our clients is used to seeing us and being in our drop-in center, but they haven't been able to do that for like 8 months. So we had set up basically like a drop-in center outside. We had kids and lunch and stuff like that, hand sanitizers, masks, you know, everything they basically needed. And we had clients coming to that. We had clients on daily coming to that. But now we trying to like basically move into zero gravity chairs, so we can have at least 3 clients at a time, like breasting each day with the heaters, hand sanitizer, face mask, gloves, feet warmers, hand warmers. Like, that's what we're trying to move into now. That's our next phase. So basically, I'm trying to just look forward to that and just being there for the clients. It's kind of hard because I be in the alleys. I be everywhere they be at every day, like 4 days a week. And I see them building more encampments and things like that. So I'm kind of glad that we started like a housing program. I'm kind of like proud of that we started that, because a lot of our clients are sleeping in these encampments. So yeah, I'm just looking forward to that. We got a good housing team that's really working hard trying to build a housing plan for them. So that's what we kind of looking forward to as far as the winter months, you know. Other than that, everything else is going good. We doing a lot of outreach. Like I said, it's going like, we did like 3 times the amount of supplies in the last 8 months that we've been giving out normally. So we reaching a lot of people. We've been with the supplies that we give out. We had the bomber sock donation, and I was giving them out during the summertime because a lot of people like didn't have clean socks and they wanted to be fresh and stuff. So I like kind of exhausted, and I'm kind of mad about that because I gave out everything we had in the summer. So now we got to try to get like winter supplies, which we're trying to do now, but they said we can't really get nothing to 2021. But we ain't mad because we'll figure it out. We'll get some supplies from somewhere. But other than that, we just trying to get more donations for like Cokes and things like that. We got a good steady food donation that been coming in through the Jewish community center, and my husband, he donates a lot of food, and Baltimore City Rec, we've been getting food from them. So we've been doing good with feeding people. They happy about that. They get food 4 days a week, and we ready to move into like the hot meal phase because it's getting cold, and I know people tired of sandwiches. So we trying to like figure out how we can get them hot meals. So other than that, that's all we doing.
That sounds like an awful lot. Thank you.
It's an awful lot, but I love what I'm doing, and it's just I just be happy every day going out there working with the people, because to be honest, there's nobody else doing the work that I do in East Baltimore. I mean, no one's out there at all, and I'm out there 4 days a week, and I haven't seen nobody at all. So I know what we doing is really appreciated, and they let us know every day.
Certainly getting a lot of appreciation in the chat box. So I hope you're seeing that. Okay, so some other folks talking about food distribution, both kind of meals for participants and then supplies, more of like a food bank operation. See what else is in there. If anyone has been contributing to the chat and would like to speak on anything that you've been sharing, please feel free.
So I'm curious if way back in the chat we were talking about secondary distribution points. And I'm curious if anybody has some good tips for like phone security for people who are doing that, to help keep them from being indicated in anything, or possibly even endangering programs. I mean, like outside of Signal and encrypted apps or whatever, you know. What other kinds of things are people doing to sort of make sure people are staying safe from prying eyes?
If I'm understanding the question correctly, for when we're out on the street and there's other traffic, or if you're in a neighborhood, what do we do to keep the confidentiality of the participant? Am I hearing that right?
I'm thinking more along the lines of keeping people from getting picked up by the cops, or when they get picked up by the cops, if they've got info on their phone that could indicate them in criminal activity. From a personal standpoint, I would hate to be responsible for somebody going to jail for me being like, or for me trying to get them doing secondary distro.
Sure. So specifically,
oh, okay. Somebody else can go.
I just wanted to add that Morgan's program is operating in a legally complex environment, and so if there are any programs that have experience operating underground,
that's a really sweet way to put it. Thank you.
or with complex relationships to local law enforcement who want to speak to kind of how they've navigated risk and putting peer exchangers in the position of having a lot of syringes on them, for example, if they don't have those legal protections.
Well, for us, our clients, we give out a card, and And I encourage them to keep that card on them, because as long as they have that card on them, they legally okay to have whatever they have. But from my experience, when I'm out with the police, when they see us getting stuff to people, they don't bother them. But I have wrote up on police that had our clients, and I had to really actually go talk to them. Like, I just basically gave that to him like 15 minutes ago, and he has a card, and he's legally can have this. So they'll give it back to him. But some of them just break up everything we gave them. Like, why do that? Like, that's just the smart ones. But they legally here, our program is legal, and we give out cards so they can legally have anything that we give them. So it shouldn't occur. It shouldn't be no problems occurring. But the only problem that really occurs with our clients is police just taking their things and destroying them.
And Morgan, this is Jenna, because even though syringe access is legal in 2% of our municipalities, people still get arrested with syringes all the time. And I guess one of the things is, like, people use phones for all kinds of stuff, like, that is legal and like not legal. And like, I'm sure you're already doing this, but just like talking to people about what they're comfortable with, and like stuff they're doing around like communicating more safely and reducing risk around police and arrest. But like, I guess just coming up with a collaborative plan together is what we've found more helpful, or like most helpful. And it's one of the reasons we're starting to talk about drop boxes, so that people don't necessarily have all the supplies on them at any given time.
That kind of leads into my next question. Has anybody done just like random larger biohazard buckets in like known areas of use or whatever, and just kind of started letting people use that like public trash and then go pick it up every so often? Has anybody done that? Did you have success with it? What was it like? Is it highly illegal to do that? I don't know anything about it.
We have here in Oakland, California, we call the person of the, say, camp or whatever area they're at, we call them a champion for the block. And we kind of leave them in charge of maintaining not really maintaining, but just making sure that folks are putting in their syringes, and just giving them a little more responsibility and helping keep this syringes off the street and making sure that people are safe, because that's one of the biggest complaints out here in Oakland and Alameda County is all these littered syringes. So we often, when we go into the camps, we'll leave a bigger bio bucket, and there's one or two people who are kind of in charge of that. And when we go and pick it up, we give them incentives for doing that task, and extra food or extra, whatever we have, because we appreciate them taking ownership of that bio bucket. So that's been working pretty well for us, and also getting our clients involved in, that part of the work.
Hey, this is Lauren again from Charlotte. I just wanted to add with peer exchange, and I know North Carolina has, some great laws and work that's been done with syringe access here, but we do definitely still have struggles with law enforcement and other authorities. And I really am not sure of my audience here, but as somebody who uses drugs and as a former, IV drug user, we are very smart about who we speak to, who is going to assume that risk and get involved in these sorts of things. And when you're navigating the streets and how to move through them, there are very safe ways that people can exchange and engage and inform one another. And as far as the biohazard goes, we find drop spots all over our city. The same way we would meet up with somebody who's helping with any other type of need is the same way we would low-key meet up with somebody who, was nervous about, biohazard or whatever we were picking up or taking from them. too. I hope that makes sense. I mean, we just are very smart and have these really open dialogues about, what the risk is, what the benefit is, where their comfort level is at. And it takes time. I mean, the volunteers that we have now who have really rallied with us in this pandemic are people who we've just known for years. So, it wasn't like we just found anybody and just started doing this. It was people who were really familiar with the program.
Thank you.
Just really quick, let me add that also we are giving the that champion person grabbers and gloves too. That's important to say. It's just not here's the bio bucket, do what you want to do. We are being safe about it. And thank you for bringing that up, Lauren, because it's very important to have a good rapport with the people that you're serving. And when they trust you, and we've been doing this for over 30 years, it really makes a difference, so.
Thank you.
I'd like to add too, this is Ainsley Bryce with Hollow Harm Reduction out in Western North Carolina. We had a lot of troubles between our exchange and then City Collective down in Asheville with the city, and a lot of arguments about like our programs causing extra needle litter, which, obviously isn't how things work in the world. But we were able to collaborate with the health department in our area, and they actually sponsored a bunch of syringe collection points throughout the city in areas that were really accessible to folks throughout. And we just kind of settled a deal with them where we would be responsible for certain ones that kind of cater to more of our clientele. And then ones that kind of were more of the city's jurisdiction, they were able to handle. But it kind of ended up being this nice collaboration between everybody, despite all of the drama surrounding needle litter. That, ended up working really well for our participants. The only issue that we faced with those is that a lot of folks will put their used syringes in there, and because we do have a requirement for returns, it created some issues with us being able to get returns at like a capacity that was like fulfilling what people's needs were for the needles later on. So that was our major issue with it.
Thanks, Ainsley. I wanted to add, Morgan, you're getting some feedback in the chat about drop boxes and different kinds of partnerships and setups. And then some recommendations about disappearing messages and remote resets of phones and that kind of thing. I also want to raise some of the discussion from the chat box around housing. And certainly housing has been a top issue and concern for everyone, and especially people who use drugs. Over the course of the pandemic, and we've seen the CDC eviction moratorium go into effect with kind of indeterminate results for a lot of folks. And I think part of the conversation has been a concern about houselessness for people who have never experienced that before and who don't have previously established or previously learned coping mechanisms or security networks and that kind of thing. So some questions in the chat box about how programs are talking to participants about housing, what kinds of housing needs people are seeing, and then what partnerships or kinds of external services might be helpful right now. Gina, if you're on the line, can I ask you to talk about some of the shelters that Raleigh or Wake County has been putting together?
Yeah, so I'm sorry. So Wake County had pushed out this housing. It was initially it was called the High Risk Hotel, which I was like, we are gonna have to change the name, but they found funding, and so the people that were the most vulnerable, and initially they had a lot of hands in the pot, and so realistically speaking, they were putting people out. The expectation was that either individuals would engage in mat services or not use. So people were using, they were having them leave into homelessness because the programs or the shelters that they were in were no longer accessible. They changed it, so they have healthy hotels, but what I've seen is that the funding is starting to dry up and the hotels are not as happy with the individuals. So it's a lot of displacement going on. There's this other funding coming from Alliance, which is ILI funding, but that funding has a requirement of some kind of recovery. So individuals are really displaced. They're moving people from Wake County to Durham. And it's just, I mean, I think the funding is going to run out at the end of December. I think somebody put that in the chat box, but not only that, they have peer support specialists out there, and they also have like mental health people there. And I know they're trying to do good work. I just don't think it's realistic, and the funding is starting to run out. That's in Wake County though, so I don't know about the rest of the state. I just know we were happy that they started that, and then there had to be a lot of dialogue in what the expectations were. They found transportation all of a sudden for MAT clinics, which was amazing. And as COVID has changed and the restrictions have changed, all of a sudden we're seeing a shift, which I think is completely realistic. I mean, as to what's going to happen, but not that I'm happy of it, but there has been funding for individuals that are the most vulnerable. That's all I got, Lil.
Thank you.
Hello, my name is Crystal. Hope everyone is well this Friday. I am from Charm City and I'm the new housing case manager. And what we are actually doing is taking on the Housing First initiative, where we actually house our clients and then, excuse me, we follow up with case management afterwards. So how it looks is that we put the lease in our name, the organization, so that way that eliminates, excuse me, I just was running up and down the steps. That eliminates, you know, them to have to provide any type of documentation, or they don't need any income in the beginning. So the main thing is we're going to get them housed and then everything else comes later. And so far we are just starting. So pray for us. It's going to work out.
Some more excellent work being done by Charm City. Thank you for sharing that.
Yeah. I really like that idea. That's pretty awesome. Sorry to cut you off. But I just wanted to say I think it's interesting here in Oakland, really, and all over California, how more and more folks are becoming unhoused, and we really don't have a solution for it. Everybody is just moving on as nothing is happening, and like we don't need to do something about this. And you know, for me, it goes back to eventually it's going to be civil unrest, and people, we already see folks already doing whatever they have to do to survive, especially our folks. And I guess some people are working on it, but I don't know those people. I know we go to the hotels, 2 hotels every other month, and maybe I think Abode is a group that's working on housing with folks, but it seems like nobody is really getting housed. And here in Oakland, California, we have so many empty buildings, and they putting all these high rises up and all this stuff, and they're not making anything affordable, and everything is just ass backwards to me. It's just backwards, and we're not just doing enough to help people, and people really need to start. I think we all need to start just being loud about that and making sure that those things are getting done, because our folks are just out here just, like it's about to be do or die. It's like, you know what I mean? Folks gonna be robbing people just to get something to eat, or, it's just gonna be chaotic. And it's really sad, because nobody in politics or anybody, I don't hear enough people talking about it. I don't hear enough people talking about the housing, and, something needs to be done. I don't know. It was just my thoughts. I wanted to put that out there. So good luck with your program, Crystal. I'm gonna be praying for you. I feel like it's gonna really pop off.
Thank you so much. Appreciate it.
I'm curious if others have housing experiences or strategies or anything they're trying to put into effect right now. But also following up on Denise, if I'm paying attention to our time. We've got about 20 minutes left. If there are any more messages you wanted to be sure to share today and make sure they get passed along and shared around to health departments and other folks, now's the time.
We are a hotel. We are at a fixed location and we're high barrier. And I know that's not best practice, but it's what we have and what we have to work with. And we have a lot of limitations with being a very conservative community. We also have another barrier of the adjacent town. We're connected by a bridge, but we're different counties, so we have different rules there. But when COVID initially started, we had to actually shut down all but essential services. And then we were able to restart our syringe exchange program where we had almost a drive. We had a door that we used in access where we give the people 2 weeks supplies of things. So now we have opened up our lobby, so we are able to socially distance up to 4 people in our lobby, and we see 1 person at a time. We are making packages, like many of you said. We have a resource sheet, and we live in a rural community in North Dakota, so we don't have the resources. We don't have a lot of things. We have an issue with the cold, and last year our emergency shelter shut down, and the community has taken it upon itself to open another shelter. This has been very high barrier. So again, our people who are using drugs are often left behind. So a lot of them have established a system where they leave their stuff with somebody else and then hopefully they get it back, but then we end up with them sharing more needles, things like that. So we really just try that education. But we are looking at this winter, we are still able to do HIV testing and hepatitis C rapid testing. We really try to limit our time to the 20 minutes and we wear N95 masks. But again, it gets below 0 very quickly here. It's already been that way here. So we're concerned. We've already had clients express that because we can only let 4 people in our lobby at a time, they're saying that they won't come. In North Dakota, we don't have a whole lot of syringe service programs, so it's quite a distance for them. But the ones that do come, they're very, very thankful for any services we can provide. And, it's always changing. We're always trying to look at a new process. So coming to some kind of forum and listening to this is very helpful for us to get us ideas how we can implement a better practice in helping our clients.
Thanks, Rebecca. I'm sorry if I missed this at the beginning of your comment. Have you all been able to do any mail-based exchange over the course of the pandemic?
No, that is not something that's authorized by our county commissioners, our state health department, and then also, our policy for our facility. Like I said, we're very high barrier. We actually require them to be tested to be a participant in our program. We know that this is not best practice. We want to move forward, but right now with all of the other things that come into play, this is the service that we can provide. And that's another thing. We've been supplying syringes. We've doubled our supply for them because we want them to come, but we know it's a hardship for them to come. We want to minimize that exposure. But we're running out of funding, and that's a big struggle for us. We've burned through a lot of supplies, and that's where we're at right now. Like we're scrambling. So, and I'm sure many, many other people are in that same place.
Thanks, Rebecca. And yes, again, getting support from the chat box. I'm going to raise this question from Kirsten. What is your dream wish list for what you'd need to get through the winter, providing the best services possible to people, especially what you'd like state health departments or funding policy decision makers to know and ways they could be of support? Notes that I'm taking are about housing and the necessity for low threshold and shelter suitable for people who are still using drugs, the flexibility to increase supply purchases and to change supply needs, things around telehealth and making sure that those services are still available but also more accessible. What else is on the wish list, I guess? More funding for sleeping bags, tents, outdoor heaters, etc. Wound care, shelter options, yes. Harm reduction nursing, increased testing, access, yes. Are you all seeing, this is a little bit besides the point, but we've been hearing lots more requests in the way of wound care, possibly stemming from the changes that we've seen in the drug supply and different cuts and additives that may be added to try and stretch supply. Have folks been either adjusting wound care services or just observing any changes in requests?
Hi, this is Jessie again. I'm a nurse practitioner with Baltimore City Health Department and Spark. I've definitely seen a lot more wound needs. I think part of that is because we're doing more street medicine and seeing sort of a different population in a way than folks who, you know, have the resources and privilege to walk through our door. So definitely have seen more wounds. I also think that there's probably more wounds in general, just because people are not seeking medical care as much because they want to avoid the emergency room and such. So what was your second part of your question? Yes, there's definitely more wounds. Definitely seeing that.
And then I guess if you've kind of changed services at all to respond, but it sounds like it was almost reversed, that you all were increasing the street medicine and outreach and then documented. Was that right?
Yeah, we increased street medicine and are seeing more wounds. I think that there's also more wounds in general, and doing more, I guess, intense wound care on the street, things like debridement and things that we would normally, you know, try to reserve for, I don't guess, sterile procedure. But wounds are already not sterile, so it's really unnecessary to do that in a, you don't really need to be in a sterile room to do that. And then providing more wound care kits to clients themselves to maintain their own health. In our outreach are like weekly deliveries. So people that we know we have chronic wounds will put in pack, you know, whatever wound care they need to maintain that.
Thank you. Yeah. Lots of comments in the chat box around wound care. Access Point Pueblo shared, yes, we are hoping to work with local nursing students to get educational resources to our participants. If you all have MOUs or can talk about that process, I think a lot of folks would be interested in the kind of logistics of joining with medical students or medical staff. Yes, agreeing that folks are trying to avoid hospitals.
So here at HEPAC in Oakland, we work with two healthcare agencies. One is the Roots Community Center in Deep East Oakland. They come to our Tuesday and Thursday exchanges with a nurse, or a nurse practitioner who does the wound care, a medical assistant, and a couple of their other crew, and they come every Tuesday and Thursdays, and they do absolutely everything from mat to wound care, mostly wound care, and other health issues. And we used to have an MOU with them. This is probably going darn near into the 3rd or 4th year. And basically we came up with this idea because it was a need. We wanted to have the mobile medico, and it was a very easy MOU that we both signed. Just, okay, y'all gonna do this, we gonna do that, and let's make it happen. And it's been happening ever since, and we absolutely love it, and so do our participants. And then on Friday, we have the Trust Clinic, who is through Lifelong Medical. They come every Friday, and they basically do the same thing. And they also offer HIV and Hep C testing when we are not able to test, if we're, shorthand or somebody's sick, whatever. And that MOU was a little bit more difficult because they are a big old, company. There's Lifelongs all over the world. So they had to have a bunch of stuff in their MOU. I'm just going to call it stuff because I didn't write it. They wrote it, and we just agreed to it. But basically, it was just a nice little agreement. And we actually have a meeting coming up next week, so we can talk about more things. And I believe that's an exchange of a person's medical history, or exchanging of their information. And it's pretty simple. I mean, you just got to get with the group. You can go into the community, ask folks, hey, we're looking for people to do this. And hopefully you'll be like us in Oakland, and folks will be willing to do it because there's a need for it. So it wasn't a super hard process. It was pretty easy to do. So, yep.
Great. My hope would be that, yes, we know that it can be difficult for other health systems to want to hang out with harm reductionists, but hopefully the kind of joint effort of trying to keep people out of the ED right now and trying to not have things grow into crisis while another crisis is taking center stage is a good cause to rally around. Libby, if you are on the line, you had a question, and I'm hoping you haven't already answered this, about the room key and home key projects or systems that you all are putting together.
Hello.
Hello.
Hello. We're in Mendocino County, a very rural, extremely large county in Northern California. And we have a very, very, very high per capita homeless rate, and have for the last 15 years probably. But anyway, during COVID, a lot of places all over the country got funding through the room key, and we're able to use those funds to house the most vulnerable people that, were very high risk for COVID. Well, during that effort, our agency, and we're the only harm reduction agency in exchange in a county the size of the state of Connecticut plus, and we were the only ones that really jumped on board to help. And we tried to help manage, 150, better than 200 people for several months. Anyway, that kind of expanded the push on our county government to do something on a more permanent basis. So that was them seeking the assistance of the Home Key Project, which is funding that helps with permanent housing. And the county put their dollars together with a variety of other dollars, and I don't know anything about the ins and outs of their funding, but they did push really quickly with a hotel provider that helped us during room key and bought an entire Best Western hotel. It's going to be rehabbed, and it will put about 76 individuals and or their families into this place. We're having a discussion with them in the next couple of weeks about how our agency is going to be working to make sure that people are successful. It's a major thing for our community because all the NIMBYs, you know, came up in arms, but the county had already bought in quite a bit, and the county supervisors had. So that's like one of the first things that we've really had in our county for a very long time. Once again, the problem is that it's centric to our you know, our where our major town is, and people in other parts of the county that are 2.5 hours away are not necessarily going to have any, you know, they're not going to have that opportunity. But anyway, it is exciting, and it was after, because of COVID and seeing the massive amounts of people that needed shelter, just those that were most vulnerable, was a major wake-up call. And it was like the county couldn't back away and say, okay, well, everybody get out. Because, you know, in our county, the surge happened 4, 5, 6 months into this pandemic. And that was about the time they were saying, let's open the hotels and push everybody back out. They are back out in the street right now, but we're hoping that within a few months' time, we can start housing those folks. So it's a somewhat positive thing. Thanks.
Great. You and Crystal and all of your people will be getting lots of goodwill coming out of this call for your housing efforts, and we'll hope to hear good things from you all in the next few months. I am keeping an eye on the time. We have a couple minutes left. I appreciate the comment from Ryan Del Porto in San Francisco, who is one of our harm reduction regional TA consultants. We hold a weekly Thursday SSP TA call. That is kind of a smaller version of this call, and the topics can vary, but this conversation originated out of some of those regional calls. So if you're interested in continuing with some of this strategizing, particularly if you're interested in being connected to programs also operating in your region, please feel free to join those Thursday calls. I will add, thank you, Kirsten, that's what I was just about to do. You can email the Drug User Health team at druguserhealthta@nastad.org. Any other final thoughts that folks would like to share? Looks like a lot.
Laura from, I was just going to appreciate everyone on this call. It's been really fruitful and just like exciting to hear about all the innovative things that folks are engaging in. So I just want to say that I really appreciate your engagement and, you know, all the care that you put into your communities. It really shows. And just sitting over here appreciative. Exactly. Ryan with the heart.
Great. Thank you. Great. Yes. And it sounds like a lot of good connections have been made in the chat box. And NASTAD certainly has lots of ideas of how to continue some of these conversations and addressing some of these needs. So please feel free to be in touch. And with that, I guess we'll leave you all and appreciate your time and hope you all have a wonderful rest of your Friday, going into the weekend, rejuvenating, restful, slightly spooky if that's your jam. Weekend for you all, and we'll just keep hanging in there. Talk to you all soon.
Thank you.
Thanks, everybody.
Bye.